Founded in 1913, Mulago National Referral Hospital started small and has eventually become a center of excellence in the region, offering specialized medical services. Recently, the hospital underwent remodeling to put it to the level of providing high-tech medical services, and the aim is to save Ugandans but also people in the region the high costs of seeking treatment abroad. Such high-tech services include neurosurgery, one of the most sophisticated procedures, with one operation taking about 8 hours.
Important thing is being able to enjoy, and what makes us enjoy it is one, being able to see someone who comes in who is unwell, and then when you get to the time of discharge, these are people who you can talk to, who you meet in the street, and they greet you and say, "Hey doctor, you helped me," and you say, "I can't remember you," and say, "Yeah, you did, you operated on my brain." I think that is a very rewarding feeling that we get, and that's why you see that we are always here to work.
Mulago National Specialized Hospital has 22 theaters designed for specialized surgeries.
And these are equipped with modern equipment and modern technology. The lights are very good. You have pendants which you use to connect the infusion pumps and anesthesia machines. They are kitted with viewing boxes which are electronic, and you can retrieve patients' information and even images on that. And you can control the ambience in the room, the lighting, dim it, make it a bit bright, or even the lights in the theater lights using that kind. So because we are trying to go digital in the entire processes, so even the patient's images and notes should be able to be retrieved through this IT system within the theaters.
This is what we do. In case you are rotating to a patient, you rotate and focus to the patient at any direction you want, whether you move it aside, then you rotate and you position it according to the operation.
The hospital, with 1,700 bed capacity, is now focusing on continuous training and reskilling of specialists to achieve the number that can handle the overwhelming patients.
Mulago National Referral Hospital has the biggest number and wide range of specialists and super specialists. Our infrastructure has developed from the examples which I've given you: increasing ICU capacity, increasing theater space so we can do more surgeries, increasing on the skills mix, because even when you are going to take an example of renal transplant, you need so many specialists. The nephrologists who will prepare the patient for the surgery, the surgeons, then the one who will receive the kidney and clean it up, so to say in the layman's language, before it is transferred. That is called a perfusionist. All these anesthesiologists, people who have done masters in anesthesia and trained also into critical care, because they are trained to look after critically ill.
Although the hospital is supposed to manage specialized cases, it continues to handle people from Kampala metropolitan area, with 100 to 200 patients registered daily.
Would ideally function as a referral and only handle the referred cases. So would expect maybe patients coming in with written referrals or being brought in by ambulances. But remember, we also are on a hill where there's a catchment area, and any patient falling sick will definitely walk in, and it becomes very hard to turn off. We have created clinics to handle the walk-ins who would ideally be seen at level of health center 4, so to say.
The role of government now is to ensure that Mulago National Specialized Hospital is well funded so it continues to perform to its expectation. Adia Nakute, UBC.